Good evening. I'm Phil Rogofsky, founder and executive director of the Maryland STEM Festival. Tonight, we are very fortunate to have partnered with the National Alliance for Mental Illness of Maryland to bring you a program on this very important topic, which impacts a lot of people in Maryland and around the world. So I am going to, at this point, be turning the program over to Dr. Gia Greer McGinnis, who is a board member of NAMI Maryland and will be leading our program on the topic of mental health. So, Dr. McGinnis?
Hi, everyone, and thank you for joining us. My name is Gia Greer McGinnis, and as Phil said, I'm a board member at NAMI Maryland. NAMI Maryland is the National Alliance on Mental Illness Maryland, and we are dedicated to providing support, education, and legislative advocacy for the millions of Marylanders who are affected by mental illness. You can learn more about NAMI Maryland at www.namimd.org. I'm glad to represent NAMI and be the moderator for this amazing panel. We are so excited to be a part of the Maryland STEM Festival this year. This festival highlights the educational, cultural, and financial impact of science in the state. Through hands-on activities, talks, lab tours, nature experiences, expos, exhibits, and performances, the festival engages a wide range of public audiences while inspiring future generations. We've invited our incredible panel of experts to speak about their careers and what drew them to their fields, covering 3 areas: application and data collection, brain research, and practical mental health research. And now I'd like to welcome our speakers. Our first speaker is Dr. Holly Wilcox, who is a professor in the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health, with joint appointments in the Department of Health Policy and Management, as well as the Johns Hopkins Schools of Medicine and Education. Much of her work involves population-based research on suicide, intergenerational studies of suicide, the evaluation of impact of community-based universal prevention programs, and data linkage strategies to inform suicide prevention. Holly leads a multidisciplinary interdepartmental suicide prevention work group at Johns Hopkins. She has a diverse publication history that demonstrates her experience in biological, psychological, and social factors in suicide. Holly was appointed by Governor Larry Hogan to the Maryland School Board. She also co-chairs the Maryland Commission on Suicide Prevention. Holly has twice received the Johns Hopkins Bloomberg School of Public Health's Excellence in Advising, Mentoring, Teaching, and Research Advising Award. Our next panelist is Dr. Abu Matar, who holds dual board certification in family medicine and general preventive medicine public health. She is an associate professor of medicine and public health at the Johns Hopkins University and director of the Center for Engagement and Patient-Centered Innovations at Johns Hopkins Armstrong Institute for Patient Safety and Quality. Dr. Abu Matar conducts research on healthcare services improvement. Her research focuses on patient-centered care, patient-provider communications, peer support, and patient and family engagement. She has published over 45 peer-reviewed articles and obtained peer-reviewed grants from the Agency for Healthcare Research and Quality, the Patient-Centered Outcomes Research Institute, the Picker Institute Gold Foundation, and the Gordon and Betty Moore Foundation. Last but not least, our final panelist is Dr. Mark Kavarta, who does translation research focusing on how stress affects our neurobiological framework to underlie key symptoms of depression and other serious mental illness. He focuses on linking neuroimaging, neuroendocrine, and genetic measures to clinical measures of depression and stress in humans. He aims to increase our knowledge of how exactly stress across the lifetime changes our brains to cause specific symptoms and ultimately create a path for developing and understanding better treatments. Well, thank you all for joining us tonight. And we have some questions prepared, but we'll also open it up to the audience for questions. You may post your questions in the comments section and we'll provide them to our panelists. But we do have a couple of questions to get our conversation started. So would each of you please tell us about yourselves and a bit more about the work you do?
I can jump in and go first. I focus on public health prevention and of suicide, and so I work in settings such as schools and in hospitals, and trying to uh, get measures in place to identify people early who are struggling with various mental health concerns, and working to do training to prepare teachers and workforce, people in the schools in various settings on how to identify people and what to do once they do identify folks at risk for suicide.
Shall I go ahead? Yeah. All right. Okay. Well, I'm going to tell you a little bit about myself first, and then what I do. I was born in Lebanon. It's a country in the Middle East. It's about a third of the area of Maryland. So you can fit 3 Lebanons in Maryland. My mom was a history and geography teacher, and my dad was a farming instructor and farmer. At school, I loved science and math, but I also enjoyed studying literature and particularly poetry. In high school, it was hard for me to decide what I wanted to do because I loved many things. And but I liked the idea of learning something that would allow me to help many people. And medicine seemed to be a good way to accomplish this. And so I decided to go to college and do pre med. And so in college, I studied chemistry and took my pre med courses and then went to medical school. In medical school, I learned about this specialty called family medicine. And I was really intrigued by it because in family medicine, we treat everybody in the family, from the very young children to grandma and grandpa. And I like the concept of thinking about people beyond just the medical problem they have, but really thinking about their life journey and how they interact with their families and the community at large. So I was really fascinated by that. And family medicine was not that training was not readily available in Lebanon. So in fourth year of medical school, I signed up for an elective for 1 month, and I came to the US. And I did a 1 month of elective in Cleveland, Ohio, in a program at University Hospitals of Cleveland. And that is a hospital that is affiliated with Case Western University. And so I really liked my experience here. It was my first experience learning abroad. And I decided I'm going to come back in a few months and start residency training in family medicine. And so I did. I came back back to Cleveland, Ohio, same place, did family medicine, and started taking care of people as a family physician. Now, over time, I felt that I wanted to help do some improvement in how healthcare is delivered, because I felt that it doesn't matter how great um, I was trying to be as a physician in caring for my patients. Um, it felt like there is more that they needed to get better. Um, and and I didn't have the tools and the skills to be able to do changes in the healthcare system or do programs in the community to help do that additional effort to help them get better. And so I felt I needed more training. And so I applied for Johns Hopkins Preventive Medicine Residency Program that allows me to learn preventive medicine and do my MPH at the same time. And so I did my master's in public health and preventive medicine training and started working at Johns Hopkins. And I've been working on healthcare improvement work, particularly with people with chronic diseases. And we can talk about that a little bit later.
Trying to get Dr. Oh, it's not adding this.
All right, am I up now?
Yeah. Just tell us a little bit about yourself.
Of course. So I'm originally from New Jersey. I was always interested in the brain and just a math and science geek in general. The biggest things that drove me sort of even going into college were, space and aliens, and can we find aliens living in outer space, and can we find life on other planets? And at some point I realized that's probably not practical enough to do anything for people around us. So I was preparing to go to medical school, and I did a research project at Cornell University where I was studying the noble lobster. So these little lobsters that have no spine, but they don't have a spinal cord, but they have these little neurons that control digestion, and not too different than the way our spinal cords actually do work. But there was only 30 neurons, and all of them could be identified. And there's these big things you could see under the microscope, and you could stick an electrode into them and stick an electrode into a different one, and you can see what they're doing in real time, almost like wiretapping, like a living signal. And at that point, I got really interested in doing research. And so between that and some really interesting books about how the brain changes with experience, whether it's after a stroke and things start to heal a little bit, or just how a little baby learns over the course of their life to become an interesting adult who does something with their life and has their own kids and memories and all those things. So I was always really drawn to how the brain works. And so I ended up going to the University of Maryland School of Medicine for MD and PhD, a combined program. And there I got to study how chronic stress affects brain circuits in models of depression. And so this was right up similar to what I'm working on now. But what we could see is that by taking brain samples from rodents that had been exposed to stress versus those who had not, you could actually see the physical changes that had happened to their brain just after a couple months. And so it was an interesting sort of model for what could be happening to our lives, where we have all sorts of stress, trauma experiences, whether it's bullying in school or hardship or neglect or just poverty and violence. All those things really physically affect our brains. And so I've always been driven to see what is happening there, and what can we do to help protect the people who are having these kinds of things happen to them. And so currently I've moved into doing research with human patients and human participants to try to understand how these things contribute to psychiatric symptoms, whether it's depression, psychosis, anhedonia, which is the inability to feel pleasure from things that should be pleasurable, whether that's spending time with your loved ones or reading a book or playing video games or whatever it might be. And so these things seem to go haywire in some people after a lot of stress, as well as due to genetic influences. And so, like you said in the little blurb that about me, is that I'm really interested in using neuroimaging, which is imaging of the brain itself using MRI, to see what changes after stress and how that relates to somebody's genetics and somebody's stress exposures over time.
Great, thank you. And actually, I have a next question for all of you. What made you decide to go into healthcare, and how did you get into the field, and what motivates you to stay?
Should I go first for this one?
Right, I think it's making you do that.
Okay, sounds good. Yeah, so what?
You're muted right now.
How about now?
Yep, you're good now. Yep.
Okay, great. So it's a little bit of a tough one. Like I said, I've always been interested in how the brain works, and I ended up being drawn more and more towards psychiatry over neurology, which I thought I wanted to go into for a while, just because it's kind of mysterious, but also, if you think about it, it's what makes us human. Consciousness, how we feel about things. These are things that I'm sure various animals have, but they can't express them, and no one's as complex as a human, no matter what people say. And so between that, as well as a lot of experience in my extended family of mental health illnesses while I was growing up, and seeing the impact that it had on a person, that really drew me to want to make a difference in other people's lives. Because you see, whether it's schizophrenia or depression or other illnesses, people sort of in the prime of their lives, all of a sudden, lose the ability to take care of themselves or take care of the people around them. And so I was really drawn by that to see, how can we fix this? And so, I mean, that's what originally drew me into it. The second part, how did you get into the field and why do you stay? Well, I mentioned I did a PhD as well as an MD. So I'm a researcher, but I'm also a psychiatrist, a practicing psychiatrist. And part of what I say is I get to do a little bit of everything. So I'm involved in my own research projects. I have some collaborations with, at different levels, whether it's other human researchers or people that are doing more basic science, looking at animal models or even just looking at, cell cultures, those kinds of things. So all sorts of interesting things. And then some days a week I get to go and treat actual patients and make a difference, on a day-to-day basis. And so it's hard to get bored. And so that's why I stay.
Great. Thank you so much. Dr. Wilcox, what got you into your line of work and why do you stay?
Well, I think one of the more influential things was my childhood experiences with people struggling with suicide-related issues, and so from that experience, and also from some internships when I was in college and shadowing people who were working and doing various types of roles and projects and research and clinical work. And for me, I was unclear whether I wanted to be a clinical psychologist or I wanted to do something else. And I actually initially started out in being trained to be a clinical psychologist, and I didn't know much about psychiatric epidemiology or public health. And I realized once I started doing clinical work, I realized, well, I would like to do more population level work. And I think maybe with my skill set and my interests, I could make more influence or have more influence, make more impact by doing more community-based and public health work. So my career wasn't very linear. For some people, they know what they want to do when they're in high school or in college, and they just go straight right into that. And for me, I have so many interests that it was hard to kind of narrow them down and figure out what the best path would be given my skill set. So the combination of internships, shadowing, and making some decisions that may not have panned out, and then you can always change and recalibrate and change your situation. So that was my experience.
Great, thanks. I have a quick follow-up question. You talked about how an internship kind of helped give you exposure. How did you even get that internship, and how can people find internships in the field?
Sure. So for me, I went to a college that offered co-op and internships. So it was just part of the structure of the system. And so I was able to select those internships from a set of opportunities. And then when I was a little bit more experienced in college or a little more senior, I was able to kind of create my own opportunities of places where I wanted to go just by reaching out and trying to make those partnerships happen. And so it was an interesting way to get exposure because I was at 5 different placements over the course of college, 5 or 6. And very different, all in mental health, all involved suicide, but different perspectives and different types of settings. And so it helped somewhat narrow my experience down and narrow it in.
Great, thank you.
Okay. Hello.
I know you're not a mental health practitioner, so just, how did you get involved in your field?
Sure. Yeah. And so I think it's a common theme that we heard from everyone, that we were looking for a way to make a difference, and that's why we started doing what we're doing. And I think we are all trying to find meaning in our lives that way. So that's how I ended up in the healthcare field. Is basically because I felt that this may be my way of being able to make a difference, and there are many ways, and everybody have their own intuitive and innate tendencies to go in certain paths. Now, in terms of why did I end up doing what I'm doing, which is really research on health services delivery and improving healthcare, it's because of the experiences I had as I was providing care to my patients. So we care for our patients so that they can get better, but not everyone gets better. Sometimes it is because of how severe their conditions are, but sometimes it's because the way we deliver care, our healthcare system, and our way of interacting, that sometimes we don't take into account people's lives and the constraints that people have to live with, whether that be financial constraints, social or mental health constraints, even constraints that relate to their education or health literacy levels. And so I wanted to do more research in that space where I can have the opportunity to test, to design and evaluate innovative programs that can be applied in clinical settings right away, so that both the healthcare professionals and their patients and families can benefit from those. And so, particularly, I started working with patients and families in the space of where we're trying to get the health system more patient and family centered. And what we mean by that is that when we're delivering care, we're focusing on the patient as a person, as a whole person, and about the life that they're living, and considering that, not just their heart or their lung, that where they may be struggling with problems. And so I started working more with patients and families, particularly around people who have chronic health problems, and trying to help address any system barriers that get in the way of them being able to benefit the most out of their healthcare, and also at a more patient and family level, to help them learn new ways to manage their problems, ways to take charge and be really more actively engaged in making sure that their health conditions are well managed, and therefore they can end up with having a better quality of life. One of the particular things that makes me want to continue working in this area is the fact that I've had the privilege of working with patients and family members in various research projects, and I know how much hopes they have in terms of like really trying to get better and having services that are actually able to meet their needs. And so that's a really privilege and honor to be able to continue doing this work.
Great. I have a quick follow-up question. So you talked about delivering holistic care. Do you have to interface with other types of practitioners outside of physicians to do that work?
Absolutely. In fact, when you're talking about people who have chronic conditions, it is really you have to think about healthcare delivery as a team, a big team, and in general, as people get older, they don't have just one condition, and typically they do have multiple conditions, and their teams have to be big and have to be well coordinated. And so I have the opportunity to work with physicians, nurses, social workers, respiratory therapists, because I do work with patients who have chronic lung conditions, case managers, dietitians. So all of those people are trying to make sure that they end up delivering together comprehensive care so that people's needs are addressed. And in the end of the day, our hope with this approach is that the patient themselves and their caregiver, if they have one, are the people who are really being able to take charge of their health, and we're there to support them.
Great, thanks. And our next question is, in terms of research, what do you believe are the current barriers and how can we address them?
Would you like me to go first or someone else?
Yeah, you can go first.
In terms of barriers to research, I mean, I think of that as I can answer for you from a researcher perspective or from a student perspective. I think from a researcher perspective, one of the biggest challenges to being a researcher is the constant effort to get funding for research. I mean, we're always thinking how we're going to get funding for every single project. And many times it takes so much considerable amounts of efforts and creates constant stress that many times we end up perhaps not pursuing necessarily the projects that we want to necessarily research or think are the most promising, but projects that maybe there is a call for funding for, etc. And that's a struggle, I think, for all researchers, particularly people working in academics. The other challenge, I think, that we are getting more and more thinking, aware of, but really trying to figure out the best ways to do, is this challenge that in general we work in silos. And so that limits collaboration across disciplines. And actually, I think it really reduces the ability to innovate. And so ideally, what we need is much more transdisciplinary research that cuts across disciplines. And here, what I mean is not disciplines within healthcare, because we've been trying to do that for some time now, but really bringing together people from different fields. So bringing together, for example, healthcare researchers with social and environmental scientists, with education researchers, with informatics experts. Because if we don't do that, our way of addressing the big questions is quite limited and piecemeal and unlikely to result in big solutions. Now, to do that, though, there's some structural barriers in how research is funded that really need to be addressed as well. Because typically, funders for healthcare are different from funders for education, different from funders for environmental research. And I think funding agencies are starting to think about that as well and considering potential solutions for that. I'd share one other challenge that I think is really important, particularly in the field of healthcare services research, and that applies quite well to mental health research as well, which is about that we need to put a lot of effort, and that's good. We have to always be focused on creating strong relationships with the community, to make sure that there is some ongoing trust, as well as good participation in research from everybody within the community. So we're not conducting research that basically applies to certain groups of the population. And to do that, we really have to address barriers to participation in research that different groups may face. A good example, for example, is many times when we're conducting research and we have limited funds, and then we're thinking, oh, well, if people don't speak English, we cannot include them in studies because, well, we have to translate all this on the instruments. We have to have research team members who speak the other language. And so these are really important issues to address, the barriers to including diverse participants from varying socioeconomic backgrounds, as well as varying ethnic and racial backgrounds.
Great, thank you.
Hi. So there are a couple barriers that that are new that weren't already described. One in this field, I believe, is that for the most part, in terms of suicide prevention, we know what works. But unfortunately, these types of programs and interventions and just don't make it to the people who could benefit from them. So they don't make it out into the communities. They may be implemented locally with grants, but not sustained after grants and contracts and funding is over. They're hard to sustain a lot of these public health, more community-based efforts. And the other major barrier is that a lot of the research right now in this discipline of, suicide prevention is focused on people who are already in crisis. And that's, I believe it's the wrong thinking. I think we need to get more upstream ahead of the problem and focus more on prevent rather than treating somebody who's struggled for a long time. Try to get ahead of the problem and do more in terms of prevention. But I think a barrier in doing that is engagement and mental health stigma. And it varies by community and in subpopulations. Mental health stigma is really quite a big barrier. And so in terms of engaging people in research and working with them as partners, people who are patients or live in communities, it's really ideal to be able to address this issue of mental health stigma and ways to reduce it in the future.
And a couple of you mentioned this challenge of accessibility and research and how to get more people interested in participating in research. Have you heard of any initiatives or anything that are trying to get more inclusion in research and enhance participation, incentive programs, or just national initiatives?
Sure, there's PCORI, which is an acronym. It's a patient-centered research outcome institutor. I hope I got that right. But anyway, PCORI is an entire institute that's directed at engagement of people in the community, like people with lived experience who have themselves struggled with mental health conditions, or their family members of people who have struggled with mental health conditions, and all the various stakeholders that are needed to get at the table to really be able to make impact. Because it's not like one of us can just do it alone. We need to really team up. This interdisciplinary approach that was mentioned earlier by Hanan is just so important. And having voices with lived experience and that teamwork really can make a lot of difference and impact.
Great, thank you.
All right, I'm going to piggyback off of what both Hanan and Holly said about the inclusion of everybody in research. So, for example, we just published a study. We were looking at how stress affects depression in the Amish population. So this is a relative population isolate. They don't interact with the sort of the general community in the Eastern United States as much as other people do. So a little bit close, and we came into it thinking that the stress that they might perceive on the day-to-day life might influence them to contribute to depression in a great way. They might be upset that they don't get access to technology that sort of the rest of us do. They have to, their education is limited to 8th grade in general, and then they have to start working. But we found out that even for the people who find these day-to-day stresses within their community quite stressful, it didn't contribute to depression in the same way that major stresses do for the rest of us, sort of how we perceive stress on a day-to-day basis. So there's something unique about what was going on in their community and that relationship to stress. And again, we had to check our own assumptions about what we were perceiving about how they must feel. And so we do incorporate people from their community to tell us about the research ideas that we have and give us feedback and how they feel about it and what they think about it, and help shape our approaches and our hypotheses and that kind of thing. But just a tiny microcosm of the importance of inclusion of everybody. If you think about a lot of major studies being done at R1 type research universities, generally have an undergraduate campus. They're looking at a specific population, and if they don't have enough controls, they'll put up a flyer and say, "Oh, let's pay a couple of college students to come in here." So, people with mental illness or any other condition, often have more than one condition, as we mentioned here. Sometimes they're at any phase in their life, whether that's middle age, older, younger. And so, sometimes a control group of 18 to 22-year-old people that are, basically getting their college education, so tend to be middle class, isn't always the best control group. And so, we do need to get everybody involved in research. And so things like PCORI and other initiatives are very important. One other major barrier to research I want to add in mental health is heterogeneity. And so that's I guess a 4-star word, but basically what it means is that even things that we call one thing are many different things. And so, for example, depression, according to our diagnostic standards, you have to basically meet 5 symptoms out of 9 to get diagnosed with a major depressive episode. So that could be depressed mood, the loss of pleasure, changes in your energy level, changes in your appetite, guilt. So basically, if you hit 5 of them, you have a diagnosis of depression. But turns out they don't have to be the same 5. And so there's actually over 200 different ways to get 5 or more out of those 9 depression criteria. So your depression and my depression might be completely different, especially when you take into context, any genetic differences or life experiences and how those work together to influence how our depression came about in the first place. And so that's, I think, one of the major barriers going forward. And people are starting to recognize that. And there's been initiatives at the National Institutes of Health, the National Institute of Mental Health, specifically to do it's called the research domain criteria. So basically to look at symptoms and biological profiles that might go across disorders because of some neurobiological relevance, as opposed to some sort of classification relevance that we might have had in the past.
Great, thank you. And actually, I'll have you segue to our next question. What do you believe is the #1 way we can make a difference in the mental health community?
I guess I'll go first if we're snaking back and forth. I think the #1 is continuing to have an alliance and have communication between sort of the people in the ivory tower doing the research, the people on the front line, so to speak, interacting with patients in the community, and then the patients themselves in the community. We all need to have conversations that go all ways, so we can all understand each other. I think it doesn't do anyone any good to only put one of those groups' interests first. I think they all kind of need to work together.
Thanks.
So this is kind of a strange answer, but I really think that one of the big things is persistence, because there is a lot of rejection that we have to face. We apply for grants that are rejected. We submit papers that are rejected, reject. And the thing is, you just have to be able to bounce back after getting bad news, no matter how bad it is. And so it's just a matter of your stamina and keeping, focus on your goals and doing the best you can, not to get discouraged and not to let these, the rejection get you down, because it's really easy to just throw in the towel and say, you know what, I'm going to give up on that. But we need more people in this field, and we need people focused, and in order to make more impact. And we need you, and we need other, we need people to be together. And so we I definitely think that persistence and determination and drive and motivation and stamina and all those factors, I think, are so important to be able to make a difference in the mental health community.
Great, thank you.
I agree with both points. I think that an additional way we could make a difference is by supporting the new generation of potential mental health activists and researchers. And to do that, I think people need to be more exposed to what is involved in doing work as a mental health advocate or a researcher or mental health practitioner. And to do that, they need opportunities such as internships that we really need very early on, not later in college, really at the high school even, opportunities where people can have a peek about how much that work is important, because it also gives hope. Like there are things to be done about the pervasive mental health problems. So it can work both ways. Um, but however, these internships need to be accessible, easily accessible, and well thought, well designed, and accessible to people from all various backgrounds. Again, various socioeconomic states, as well as various racial and ethnic backgrounds, which means that not only the schools in the more well-to-do neighborhoods would have them, but really all schools need to have them. And perhaps the schools that are in more underserved communities need them the most. Because what we really need is people from those communities to have the opportunity to be exposed to what can be done, and their capabilities supported, so that they become the rising stars in this area.
Thanks so much. I think, youth engagement and engaging young people is really important. The other hat I wear is the ED of an organization that works with West Baltimore youth to get them involved in healthcare careers. And I hear that all the way. I think it's really important.
And we heard from Holly how important her internship was in focusing her attention on this area. Yeah.
Thank you.
Thank you.
And actually, we can segue into our next question, which is about stigma. And again, I know you're not necessarily working in mental health, but even with your own patients that you do work with, how do you think we can reduce stigma for mental health conditions?
Well, first, as providers, the way we talk about mental health challenges, as a medical condition, like if we start talking about them as a medical condition, I think there is an artificial divide, and it has maybe historical reasons, had to do with how our understanding in medicine about this field, that there was this, like, there's the mental and there's the physical, and we know that's not the case, because our mental state affects our physical function all the time, and our physical function affects our mental state all the time. And so it's really never that divided. So it first starts by our own approach as healthcare professionals in terms of speaking with our patients. And I have found that in my own experience with patients makes a lot of difference when we talk very naturally, very openly about their mental health conditions and their medications and all of that, similarly to when we talk about their high blood pressure or diabetes. I think that encouragement and support helps a lot. So you don't want to, much like we were talking about, I think Holly was mentioning, you don't want researchers to give up and healthcare professionals to give up. You don't want to give up on the patients. So what a person who might be quite resistant to seeking support is certificate in one visit may not be 2 weeks from now or 3 weeks from now. So not giving up and continuing that conversation helps as well. In addition, it is so important that people feel to get to learn about others who have similar health problems. And I have referred many of my patients to NAMI as a means to say, look, there's this great community of people who are struggling with similar problems, and they've got a lot of insights about the same problems that you've got, because they had the lived-in experience with this, and they know about this much more than I do. And so that kind of support that you can provide through that peer community is probably going to be so important, because then they figure there is actually power in numbers, right? And so they feel, okay, we have our own social support system now. And then those other people are going to say things like, oh, you should take the medicine. You should go to your therapist. You should, follow up on this. Don't give up on that, because there are other medicines that may help. And so that is I think, is really essential to help us fight some of this stigma.
Great, thank you.
Well, I think that education could be one way to help address stigma. And I can give a couple examples of what I think would be ideal. And one way would be to think about schools. In schools in many states, and in Maryland, right here in Maryland, if we look at the health standards, the health education standards, and what should be communicated to students in as early as middle school, the topics of suicide and depression and mental health are raised. And so I think by doing a good job of providing high quality education, we can we can increase knowledge and improve attitudes and possibly even reduce stigma. So that's one approach, is you try to get high quality mental health education in schools as early as possible. And another approach could be when someone's treated in the hospital or by a primary care provider, a pediatrician. It would be ideal to have great patient education resources on mental health, so that when a family is faced with their first experience of getting help for their mental health condition, the care team within that setting is really prepared with high quality educational resources to give to the families that can help reduce stigma, and can, sometimes stigma is driven by just not knowing and just not having the accurate knowledge and information that people need in order to make the right healthcare decisions. So demystifying what treatment's like for mental health, because the idea that people have in their mind about what it could be like may not be all that accurate, or there could be some misperceptions that could be cleared up. And so really high quality educational materials provided in healthcare settings to families, I think, would be ideal.
All right, I think those are wonderful answers, and hopefully I can add something above that. But I just want to echo what Hanan said about how we talk about mental illness, and starting with providers and researchers, doctors, and so forth. But people with any history of any kind of mental illness, and in any kind of position of power. And so we've seen a little bit of that with whether it's celebrities or people in the royal family or anything like that. And those kinds of conversations are great. Obviously that doesn't mean we're not going to talk sensitively about things, right? I mean, if just like with medical conditions, I'm not going to go out and tell strangers about my, a urological disorder or, those kinds of things. So we're not going to talk flippantly about trauma and whatever else. We still need to use a sensitive approach and, support people. But at the same time, mental health care doesn't need to be this strange thing where we value somebody less than because they have sought treatment for some kind of health condition. We don't think negatively of somebody when they have their car in the shop to get an oil change, right? So why should we think about mental health care that much differently? We support people going to the gym. We support people getting a good night's sleep. We should support all the ways that people can take the best care of themselves and the people around them. So we tend to overestimate observations as enduring personality traits about somebody's character instead of what's going on with them at the moment. Somebody struggling with mental illness at the moment, let's say it's depression. At other times when they're doing well, they're still a loving mother, a brother, son, daughter, friend, whatever it may be. Whatever they're dealing with at the moment doesn't define them as a whole person. And so there has been at least some effort to use more patient-centered language, person-first language, right? This is a person with depression or a person with schizophrenia, as opposed to talking about it in any different way.
Great, thank you. And actually, our next question is, what are the best resources for people who want to learn more about your work and mental health in general?
Well, for my work, shoot me an email and come visit, our lab and see what we're doing, and I'll talk to you and show you around. Obviously try to read papers if you can, but that can be really difficult and hard to approach. And that's probably another barrier between research and the community is the original papers are really hard to read if you don't have the training in it. And you really rely on, press releases and writers basically. And so the best way to do that is read as much as you can for, the level that you can appreciate. And so, there's just a huge wealth of sort of popular science type books. And that's what really drove my interest when I was in college, really getting me further and further into the brain. For example, there was this book called The Brain That Changes Itself. And so it was like 200 pages and, maybe there were like 12 different stories about, just really cool things about how, brain plasticity changed people's lives, whether it's neurology, psychiatry, that kind of thing. And that was perfect for me to approach at the time. Still a great read, but it's not really, similar to what I'm working on now. So just read as much as you can, as close to the science as you can.
And for your industry, are there kind of national associations that you are a member of, and how do people join associations?
Yeah, let's see. I mean, one that I joined early was the Society for Neuroscience. And so that's a very large national and international organization of neuroscience researchers of all types. So animal researchers, human researchers, computational researchers, and people from all levels. And so I've been a member of that organization for a long time. And they have a sort of subsidiary organization called or a group closely affiliated with them called the Faculty for Undergraduate Neuroscience. And when I was an undergraduate in college, they actually gave me a travel grant to go to one of these big Society for Neuroscience meetings where there's 40,000 researchers in one giant building, which just blew my mind. It's like as big as Comic-Con basically, and it was just scientists. And so organizations like that, anything you can get access to through regional organizations or just support through your own institution. To do these kinds of things, sort of grassroots level are great. And then as a psychiatrist, I'm a member of the American Psychiatric Association and the Society for Biological Psychiatry, which are psychiatric neuroscience.
Great, thank you.
So I have a similar answer, but I have one thing that I can say that's unique, and that would be to look up the organizations that align with your interests. Like for me, it would be the American Foundation for Suicide Prevention, or NAMI, or other community-based organizations that are doing work in your area of interest, and try to get on their listserv so that you get emails and or go onto their website to see all the events that are happening, and try to take part in some webinars or go to in-person meetings. And I know sometimes it's hard to network, but try to make as much effort as you can once we're back all fully in person to do some networking with folks. But conferences, webinars, going on websites, getting the lay of the land within your area of research, and not being afraid if you see someone you've read about or who's doing work that's of interest to you, just to go up and introduce yourself or approach them or send an email or something like that. That would be my guidance in this area.
Great, thank you.
Yeah, I mean, my answers are on the same lines. I think particularly on the line of networking that Holly was mentioning, I think one thing that I would encourage people to do is to be persistent. Because sometimes it's easily to get disheartened, particularly if you're a person who is more of an introvert, to try to connect with people and not getting that response, but realize that it's nothing personal, and people are so busy. And so what happens is, if you sent an email or you try to get an appointment with someone and you didn't get that right away, it's simply sometimes that everybody is so busy. And so try again. And that second try or third try, one will make sure that your message gets across that I'm really interested. This is really something important to me. And the other thing is it shows the other person that you are really interested. So it's it one reinforces your interest, to make sure that you cut across all the noise, because there's always a lot of people approaching different folks working in various fields. I think in terms of learning more about my work, the work that I do is is not neuroscience like Mark does. People can understand the like most of the abstracts, the summaries of the papers we've worked on. So there's that, and all of these are available online. There's also for those of you who are more interested in the science aspects of things, most of the full text of the papers is also available many times online, and if not, is available through medical libraries. And of course, you can always reach out, and we can talk more about this.
Great. Thank you so much. And our last question, what would you recommend to a student or individual who would like to enter the field that you work in?
What would I recommend? At a student level, if people are in high school, I say you're gonna need to go into medical school before that. And in medical school, you may continue to like what I do, but keep an open mind, because everybody is different, and you may continue to have a lot of interest in healthcare services research or family medicine or preventive medicine, and you might find other ways. And so just keep an open mind and see what comes out. For people who are already in a stage where they are in the healthcare field, or like medical students, I think very importantly, just to get into some type of elective or some type of research project work would be helpful, because it gives you a big perspective on some of the issues that we face in healthcare, and then it may reinforce your interest in the subject, and also helps you build the skills that you need so that you can pursue applications to get more into the research field.
Great, thank you.
Yeah, I would say one suggestion I would have would be to try to talk to as many people as you can who work in the mental health field, because oftentimes we have very broad interests, but it's nice to narrow it in a little bit. And it's helpful once you start to make decisions about college and what comes after that, or just work in general, is to try to narrow your interests. And so speaking with people informally in your networks, in your neighborhood and other places, to just hear their perspective and learn more about what they do and what could be some of the challenges that they face in their job and the rewarding aspects of it as well. So those would be two suggestions. And also just reading and trying to narrow down into what things that you're most excited about when you're reading articles and reading about different aspects of research on the internet or other places.
Great, thank you.
And I would add, get as exposed as you can to the mental health care field. I mean, you can volunteer, do summer jobs, do shadowing at almost any level. Starting in high school, you can start shadowing and volunteering. And so you can do that, and you don't necessarily need to go to medical school to be in the mental health field. We need everybody. We need a therapist, social workers. We need our psychiatric nurses. We need our a great job that in another life I would have done when I was in college would be to be one of the behavioral health associates on the inpatient unit, right? The responsibility is different than for the doctors and the nurses, but you spend the most time with the patients. You're there, sort of helping people and learning how to talk to all those people who are in crisis and going through possibly the worst time in their life while they're admitted to the psychiatric hospital. And you don't need a medical degree for that, and you can get paid while doing it too. But yeah, what everybody else said, keep reading, try to get as exposed as you can and talk to as many people as possible.
Great. Well, thanks everyone for joining us tonight. We would appreciate your feedback on this event and ask that you go to the Maryland STEM Festival website to complete the attendee survey. We hope you enjoy the rest of the STEM Festival, and please do not hesitate to reach out to us through our website. Again, www.namimd.org, or by phone at 410-884-8691 should you need additional resources or support. We hope everyone has a great day.
Yes, and I'd like to thank the panelists and Dr. McGinnis for leading us in this excellent discussion. I'm sure everybody that watched tonight learned quite a bit, and of course, those who will be watching in the future will also learn quite a bit. And to feed upon the feedback, here's a little QR code that will take you to our survey. We'd really like your feedback. And again, thank you so much, everybody, for participating tonight. And again, we'll be posting this, and we ask you to encourage others to watch this as well. So thank you very much and have a great evening.
Bye-bye.